As a designated basic life support provider for your unit, you are an important link in the chain of survival for a patient in cardiac arrest. This video will provide the basic overview in use of the ZOLL PD 2000 automated external defibrillator. It will cover use of the ZOLL PD 2000 AED device as it is included in the sequence of actions when responding to a cardiac arrest. This is based on the American Heart Association Automated External Defibrillation Treatment Algorithm, which is the guideline for emergency cardiac care before the arrival of the CPR team. Responding to a patient who has gone into cardiac arrest can be one of a healthcare provider's greatest challenges. A sustained perfusing cardiac rhythm must be established within minutes. CPR can maintain a patient for a short time, but in many cases, defibrillation is required to restore an organized rhythm. The most frequent rhythm disturbance in sudden cardiac arrest is ventricular fibrillation. In ventricular fibrillation, known as VFib, the heart's electrical energy is disorganized, preventing the heart from pumping blood. VFib can deteriorate into asystole, or no heartbeat at all, within minutes. Another rhythm disturbance that can occur is ventricular tachycardia, or VTAC. In VTAC, the heart can beat at too fast a rate to sustain life. Basic CPR cannot convert hearts in VFib or VTAC to normal rhythm. For this, electrical defibrillation must be used, but the probability of successful defibrillation decreases 7 to 10% with every minute that defibrillation is delayed. The goal is clear: to provide electrical defibrillation where appropriate as quickly as possible. Defibrillation was once considered an advanced skill that was performed only by critical care nurses and physicians who were specially trained in rhythm recognition. Now, the widespread use of automated external defibrillation, or AED, has made early defibrillation by personnel with basic life support training possible. The availability of these AEDs and the simplicity of operation has greatly increased the number of personnel who can provide defibrillation, and this has shortened the critical time between collapse and defibrillation. Many hospitals have chosen the ZOLL PD 2000 and made it available wherever automated external defibrillation may be needed. If all the defibrillators in the hospital are similar, personnel can become familiar with one type of device. These ZOLL PD 2000 devices are kept in the patient care areas and maintained in a ready state with daily inspections by designated personnel. The defibrillators are set up with the self-adhering stat pads electrodes attached. Emergency cardiac care begins with patient assessment. First, establish that the patient is unresponsive. If the patient is unresponsive, then call for help by pushing a code blue button or making notification by phone to initiate code procedures, or leaving the patient for a moment to alert other personnel. After returning to the patient, open the airway and look, listen, and feel for respirations. If no respirations are present, or agonal respirations only are present, then grab a resuscitation mask, open the bag, glove, and give the patient 2 breaths using the mask. Then check the patient's carotid pulse, and if absent, begin compressions. During this brief time, another staff member in your department should be unplugging a ZOLL PD 2000 from AC power and bringing it to the patient's side. You should continue basic CPR while the ZOLL is being set up by them as quickly as possible. So on encountering an unresponsive patient, the initial actions by the first responder are to verify unresponsiveness, call for help, open the airway, and perform CPR while the ZOLL is attached. It is very important to note that automatic external defibrillation is not indicated unless the patient is unresponsive, not breathing, or only agonal respirations are present, pulseless, and weighs more than 80 pounds or 36 kilograms. The next sequence of action is determined by the number of persons who are responding to the emergency at that moment. If there are several responders at the scene, the first responder continues CPR while the second responder applies the stat pads to the patient. If you are the only responder initially and no other staff are available, you must immediately get a ZOLL PD 2000 to the patient's side, and priority must be given to attaching the stat pads adhesive electrodes to the patient instead of giving chest compressions. The stat pads electrodes should be attached to the multi-function cable when the ZOLL is in the stored and ready mode. The stat pads are applied to the patient as follows. Open the stat pads package. Peel the electrode off the inside using the pull tab. The square electrode labeled back should be applied below the shoulder blade to the left of the spine. The round electrode labeled front should then be applied to the fourth or fifth intercostal space just left of the breastbone. Roll the stat pads onto the patient's skin from one side to the other to eliminate air pockets and assure good contact. The whole surface of the stat pads is covered with an adhesive gel, so the pad will adhere completely. But the gel also allows the stat pads to be picked up and repositioned if necessary. With the stat pad system, 3 functions can be performed: ECG monitoring, defibrillation, and pacing if needed. However, there are conditions which must be considered when using the pads. The skin must be dry or the electrodes will not adhere. Use the patient's gown or a bedsheet to wipe any perspiration off the patient. No prep solutions are needed. Any ointments or gels on the patient's skin should be removed before the pads are applied. The pads should never be applied over any other device, such as wires, tubes, drains, dressings, or ECG electrodes. Any transdermal patches in the way of the pads should be removed from the patient and the area wiped clean. Transdermal patches contain small amounts of metal and can cause burns during a shock. Often these patches are skin-colored, so they can be difficult to see. If the patient's chest is quite hairy, you have 2 choices. Continue CPR and wait for the CPR team to defibrillate with paddles, or remove the hair so the stat pads electrodes adhere well to the skin. Clippers or scissors are recommended to remove hair, but shaving produces microabrasions which can lead to skin burns. Even if you try to remove the hair, the reality is the CPR team will probably enter the room while you are working with the patient and ask for paddles. The stat pads must be placed at least 5 inches from any implanted generator, such as a cardioverter defibrillator or pacemaker. An implanted permanent pacemaker can prevent the ZOLL 2000 from advising a shock. If no shock is advised, you should continue CPR until the CPR team arrives. If the patient has an implanted cardioverter defibrillator, the caregiver should proceed with automatic external defibrillation if the ZOLL displays shock advised. You may feel a slight shock if the implanted device fires while you are touching the patient, but this will not hurt you. If the internal device is delivering a shock to the patient, wait for this cycle of shocks to finish before pushing the Analyze button on the ZOLL. Remember to tell the CPR team about the presence of any implanted devices. It is important to check the function of implanted devices after defibrillation. Other implanted devices, such as a Metaport or an inferior vena cava umbrella, will not interfere with the function of the ZOLL 2000, and these devices are not known to be affected by defibrillation. The ZOLL switch should be turned to defib analyze while the unit is being brought to the patient so the device warms up. This turns the power on and automatically sets the energy level to 200 joules, which will be the level for the first charge if a shock is advised by the ZOLL PD 2000. Notice that all the defibrillation dials on the ZOLL are red. Once the stat pads are placed and it has previously been established that the patient is in cardiopulmonary arrest, the ZOLL PD 2000 may now be put into action. The operator clears all persons away from the patient and then presses the red Analyze button so the ZOLL 2000 will analyze the patient's ECG. The ZOLL PD 2000 has been shown in extensive tests to be highly accurate in its analysis of ECG rhythms. It is important to stop CPR and avoid contact with the patient from this point on so that external movement of the patient or cables will not affect the rhythm analysis nor caregivers get shocked. If the ZOLL 2000 detects either ventricular fibrillation or a ventricular tachycardia in excess of 150 beats per minute, the messages shock advised and press charge will be alternately displayed. The operator now pushes the charge button, which is labeled number 2. After 6 to 10 seconds of charging, a charge-ready continuous tone will sound, and the message defib 200 ready will be displayed on the monitor. The operator must clearly announce, "I'm clear, you're clear, we're all clear," before pushing the discharge buttons. Then look to make sure that all present are clear. Many caregivers are not used to taking charge in an emergency situation, but at this moment, you are responsible for the safety of those around you. When pushing the discharge buttons, look at the patient, not the defibrillator, to make sure everybody stays clear of the patient, any equipment attached to the patient, and the bed. Press and hold both discharge buttons simultaneously. The red discharge buttons are labeled number 3 and are located on the multifunction cable. In most cases, the patient's muscles will contract in response to the shock. In this case, it is very evident that the ZOLL 2000 has discharged properly, but the patient does not always jump. Skeletal muscle response to the shock may be affected by sedation, anesthesia, body temperature, drug overdose, the interval without spontaneous circulation, and the patient's muscle mass and general condition. Other indicators the operator can use to determine that the defibrillator has discharged into the patient are: an offset deflection will appear on the screen. A click is heard on discharge. A defibrillation message is printed on the paper. After discharge, immediately push the Analyze button again. If the ZOLL 2000 displays a no shock advised message, check the patient's pulse. If pulse and respiration have returned, give the patient oxygen and wait for further instructions from the CPR team. If there is no pulse and no respirations, but the ZOLL 2000 displays no shock advised, resume CPR. If the message is shock advised, repeat the defibrillation procedure for 2 more shocks without pulse checks in between. The ZOLL 2000 advances automatically to the next charge level of 300 joules and then 360 joules. After the 3rd shock, do not push the Analyze button again, but instead check the patient's pulse. If there is no pulse, resume CPR for 1 minute. After 1 minute of CPR, stand clear of the patient and push the Analyze button. If the ZOLL 2000 displays shock advised, deliver 3 more shocks at 360 joules. It is very important to clearly remember the steps involved and perform them accurately without undue hesitation. Turn the ZOLL to defib on Analyze as it is being brought to the patient. Attach the stat pads in the proper manner. With everyone standing clear of the patient, press the Analyze button. If shock advised, push the charge button. Wait for constant charge tone and ready message on screen. Make sure all personnel remain clear. Look at the patient and press and hold both discharge buttons. Press the Analyze button immediately. Give 2 more shocks if advised. If the pulse is still absent, perform CPR for 1 minute. Check the pulse. If absent, press Analyze. If indicated by the ZOLL 2000, deliver 3 more stacked shocks. If pulse and respirations return, put oxygen on the patient, check blood pressure, and prepare for IV insertion. Clear communication with the CPR team when they arrive is critical. The senior assisting resident leads the CPR team. Give a concise verbal report to the team. Make sure you tell them your initial assessment of the patient and subsequent actions. What directions have appeared on the monitor screen, the number of shocks and voltages given, pertinent history of the patient, include any implanted devices and any medications recently given. Show them the ECG strips that automatically printed out from the ZOLL PD 2000. When the resuscitation is finished, push the summary key on the ZOLL PD 2000. This function provides a summary of the initial rhythm and all defibrillations and pacing if this function has been performed. Note that the data collected by the ZOLL 2000 are only stored in the machine for 5 minutes after the machine is shut off. If you are asked to change the paper in the ZOLL PD 2000, push the dot on the box. Open the door and remove the spool. Put a new roll in the spring-loaded holder according to the diagram on the box. The ZOLL may display additional messages that indicate other actions or point out problems. You should be familiar with these other messages to avoid confusion and loss of time in a cardiac emergency. These are advisory messages the ZOLL PD 2000 will display in certain situations. Noisy ECG, retry analysis. This message is displayed when the ECG signal quality is too noisy for reliable analysis. When this is displayed, attempt to reduce the sources of trouble, which might be loose electrodes, damaged cables, patient or cable movement, or staff activity. It is possible for nearby electrical equipment to interfere with analysis. If the patient is having a seizure, analysis will have to be delayed until the seizure stops. Electro pads off or electrode short. This is displayed when the electrode contact is faulty. Check application of the stat pads to the patient and all connections. Select defib. This may be displayed when the Analyze button is pushed, but defibrillation is not the selected function. In this condition, move the dial from either monitor on or pacer on to defib on. The ZOLL 2000 system can be operated by either battery power or plugged into a regular AC wall outlet. If the battery is low, a low battery message will be displayed and a tone will sound. If that happens, the ZOLL PD 2000 should immediately be plugged into a regular wall outlet. The ZOLL PD 2000 can operate for about an hour on battery power if the battery is fully charged. If the ZOLL PD 2000 loses power or will not function in an emergency situation, CPR must be performed while the difficulty is resolved or another ZOLL defibrillator is obtained. When the ZOLL is plugged into a standard 120-volt AC outlet, the system will automatically run independent of the battery system. The power for the ZOLL system is maintained through the power charger unit, which is attached to the back of the ZOLL PD 2000. The function of this power charger and the condition of the battery are displayed on the ZOLL 2000 with LED status lights. An on indicator means that the unit is plugged into regular AC power. A battery-ready or charger-on indicator shows the status of the battery in the device. A fault indicator shows that there is a problem. Take the battery out and put it back in, making sure it is seated in its well. If the fault indicator stays on, call biomedical engineering. The ZOLL PD 2000 must be maintained in a state of readiness if early defibrillation is to be accomplished. The devices are stored with the multifunction stat pads electrodes already connected. The special packaging permits the wires to be connected without compromising the seal of the pads themselves. If the stored device is left off and unplugged for more than 4 minutes, a chirping alarm will sound. Every ZOLL 2000 must have a maintenance check performed according to hospital procedures by a designated person on the unit. This check includes making sure all essential emergency supplies are present, using the test connector supplied, discharging the device at 100 joules, checking the expiration date on the stat pads, signing the emergency equipment check sheet. The survival of a patient in cardiac arrest due to ventricular fibrillation may depend on how swiftly and competently you put into use the information presented in this video. You must clearly understand and remember the action sequences described here to achieve successful resuscitation of a patient in ventricular tachycardia or fibrillation. Remember, first responder, verify unresponsiveness, call for help, open the airway, look, listen, and feel for breathing. Perform 2 rescue breaths. Check for a pulse. Give chest compressions and continue CPR. Second responder brings ZOLL PD 2000, turning it on as it is being delivered. Attach the stat pads. Clear everybody away from the patient. Analyze. Wait for constant charge tone and ready message on screen. Shock if advised. Give 3 stacked shocks if needed. Check the pulse. No pulse, do CPR for 1 minute. Analyze. Shock if advised. Learning to operate the ZOLL PD 2000 is not difficult. When a patient suffers a cardiac arrest, the clock starts running, counting the minutes that mean survival. You can make a difference. The goal is to defibrillate where appropriate within 2 minutes. Study the American Heart Association defibrillation treatment algorithm. Keep your training current. The survival of your patient, your safety, and the safety of your coworkers depends on it.